My name is Dr. David Benversi, and I'd like to share with you the most effective way that I've found to help alleviate the pain and the symptoms associated with a spinal pinched nerve. Now, there's a couple main therapies that we use in our office to help out with this, and by themselves these three therapies are very effective, but when we're using all three of them together, it is extremely effective. And those three therapies are the chiropractic adjustment, muscle stimulation, and also traction. The chiropractic adjustment helps out in two main ways when we're talking about the spinal pinched nerve. The first thing, when we're looking at the pinched nerve, the chiropractic adjustment helps out if there's any type of disc bulge or disc herniation or any type of disc irritation on that nerve. So the adjustment will help alleviate the pain associated with that. The next thing that the chiropractic adjustment helps out with is if we have the bones above and below that nerve when it's coming out, if those are causing the pain in your situation for that spinal pinched nerve, and we start adjusting those areas, that again will free up that area and allow that nerve to become unpinched and reduce the pain in that area as well. With regards to the electrical muscle stimulation, there are three main factors that we are looking at helping with that electrical muscle stimulation. Now, when we apply that electrical muscle stimulation to your area of that spinal pinched nerve, typically we'll place a couple pads right around that particular area, and we'll be running a mild pulsating electrical current through that area, and it's very comfortable, very safe. And again, that does three main things. It will decrease the pain, it's going to decrease the muscle spasm or muscle tightness, and it's also going to decrease the inflammation in that area as well. Now, with the decrease in pain, that electrical muscle stimulation will basically act like a nerve block to that area, so it more or less shuts down the pain receptors in those areas, so that the reduction in pain will be almost immediately when we're working in that. With regards to the reduction in the muscle spasm, when we're sending that mild electrical current through that area, it actually will help relax those muscles, so that those muscles are able to relax and not be super tight, and a lot of times causing some of that muscle or that spinal pinched nerve itself. And lastly, it's going to help out with the inflammation in that area. And again, with that pulsating electrical current that's going through there, it's going to almost have a mechanical effect where it's going to help pump out some of that inflammation of that area, which we know the inflammation in that area is one of the main factors, the contributing factors to the pain that's associated with that. So a lot of times when we have patients in our office and they're being treated with their spinal pinched nerves, we're going to see a reduction in the pain that they're experiencing. We're going to see an increase in the range of motion that they have, and we're also going to see a decrease in the muscle tightness and the muscle spasms in that area as well. Now, those are very important things for people, because if they're at their job or at work and not having to deal with that spinal pinched nerve any longer, they're able to function for longer periods of time at work, they're able to perform their job for longer periods of time, and overall they're able to perform at a higher level at their job as well. When it is regards to their activities of daily living, those people are able to perform their activities of daily living in a much more pain-free fashion, with regards to being able to take a shower, being able to wash their hair, to comb their hair, to get dressed, to be able to tie their shoes. And lastly, it's also very effective in helping people sleep better at night. A lot of people, when we see them coming in with pinched spinal nerves, they are not able to sleep as well with regards to being able to fall asleep, stay asleep, or get that quality sleep that they really need to be able to rest and be ready for the next day. So if you're experiencing pain, we'd love to help. Please give our office a call at 618-519-9334.